I've always had a passion for medicine, and what better way to serve that passion than to become a physician? I've always had an interest in the life sciences, but part of me also has a thing about the physical sciences. So I've vacillated between them over many, many years. In point of fact, my undergraduate degree was in physics. I received that from Fordham University. And then just before deciding upon whether or not I should get a PhD in physics, it came upon me to apply to medical school. I've learned many years ago that you really have to take your time treating patients. You really have to let them tell you what's wrong with them. I don't know any other way of doing that. And if you have several thousand patients, you will reach a point where logistically that becomes an impossibility. So contracting the census down to what I have done now, I will be able to give the patients the kind of care that I feel they should be getting. And that's why I decided to convert to the concierge model. I decided to partner with Castle Connolly Private Health Partners after doing a bit of research. They're a well-known, well-established, and well-respected outfit. Program called SENS that is orchestrated by Castle Connolly. And that basically is a wellness package that is centered on the acronym of SENS, which is Sleep, Exercise, Nutrition, and Stress Management. And this is handled by several members of Castle Connolly that will integrate that part of the practice with what we do on a daily basis in our office. So it stands to be very well coordinated. Since Castle Connolly is a national recognized group, they do have professionals in other states. So we are prepared if the patients do travel to other parts of the country and have a health concern there, then Castle Connolly is prepared to recruit the services of those other physicians on my behalf. Video conferencing is picking up throughout the country. I know that many of the institutions now employ it and have it as an availability perk for the care of their patients. We'll certainly incorporate it in the same vein. So the patients will be able to contact me, and it's clear that it will never take the place of having the patient in your presence where you can examine them. But for certain things, rashes and so forth, I mean, it would be an ideal connection point, so that way they would still be afforded the care that they need. The only thing I can tell my patient, I have no great capabilities. I just try very hard. I do my best to listen. I do my best to get the patients to where they have to be, because, as I've said many times in the past, how the patient fares carries my signature. So I want to sign it with excellence. Probably one of my passions that remain now is that I'm an avid reader. I spend a lot of time at home with my family, and I value it very much. All I can say to my prospective patients, and I believe the patients already enlisted in our program know this, I will give the patients my 100%, and that's a pretty good quantity in my estimation.